A periareolar breast augmentation refers to a breast augmentation performed through an incision along the areola. So the border of where the areola or the pigmented skin meets your normal colored skin. At that junction, an incision is made, and through that incision, the pocket is made for the implant, and the implant is placed. And the subsequent scar is a scar along the border of the areola. And this scar is generally from 3 to 6 o'clock along that lower half of the areola. In order to be a candidate for this type of breast augmentation, you need to have a large enough areola that the pocket or the room, sort of the space to get in and put an implant in, will be large enough through an incision made along that border. So some women have very small areolas, and there's no way to perform a breast augmentation through an incision along their areolar border because the incision would not, the subsequent space or room that would be created through that little incision would not be enough to perform the operation. So I'll be able to tell you when I see you and measure your breasts. You can also send a virtual consult, but most women are candidates for a periareolar breast augmentation. There are some women whose areolas are just too small and they are not candidates for a periareolar approach to a breast augmentation. The advantages of a periareolar approach to breast augmentation is that the scar is hidden along a natural junction in skin color and texture. So that is one advantage. The other advantage is that it is often, this approach to breast augmentation is often used when combined with a periareolar lift. So if I'm doing a donut lift or a donut mastopexy, as well as an augmentation, I will make the implant pocket and place the implant through that incision, since that incision is already part of the breast lift. The major downside to the periareolar approach for breast augmentation is that it has the highest likelihood of changing your nipple sensation. It can make your nipples more sensitive or less sensitive. So that would be the primary reason to shy away from a periareolar approach to breast augmentation in favor of an inframammary crease approach or a transaxillary approach, because the latter two approaches have a lower likelihood of changing your nipple sensation. To learn more, check out our website where you can upload your photos and concerns as a virtual consult. You can also check out our price estimator to get pricing information for all the various procedures we offer. And finally, if you'd like to have your questions answered on a future podcast or Q&A video session like this, please leave a message on our SpeakPipe. You can go to our blog page and our SpeakPipe is located there. Thanks for listening.